typically in the younger children, we're still using the classic ketogenic diet, and I think that's the most effective treatment in a child under 2, and we typically use a classic ketogenic diet for most kids under 6. For the older children, sort of between 6 and 12, we'll talk to the parents both about things like a modified Atkins or a low glycemic versus a traditional ketogenic diet, and we sort of talk with the families and make a decision together what is the best option for them. For most adolescents, we are moving towards starting with something like a modified Atkins or a low glycemic, because I think that's just better tolerated, and we get better buy-in from the kids and from the families. That's just something they can do better and tolerate better. Much to the Charney Foundation's very hard work, this has really become, I think, a mainstream therapy for children with epilepsy, and particularly intractable epilepsy, who are not going to be candidates for epilepsy surgery. And many of our very young children with epileptic encephalopathies, and those are children where the seizures are happening so frequently that they really have, the seizures have significant impact on learning and development of those children. Many of those children are not candidates for epilepsy surgery. We know that further medicine trials are very, very unlikely to benefit those children, and I think the ketogenic diet is a really valuable option for those. So I think that the trend certainly has been to consider a ketogenic diet much earlier for those patients. And I think that we are still also learning that we can utilize the ketogenic diet with efficacy and with better tolerance, utilizing things like the modified Atkins or the low glycemic index diet in teens and in adults who have medically intractable epilepsy, who maybe would not have tolerated the traditional ketogenic diet, but now we have these other valuable options. So I think that certainly, from my standpoint, this is an area that is still, I think, increasing. We're increasing the use in epilepsy.